Now, I wanted to also provide some people not just the doom and gloom of everything, but a little bit of positivity and prevention, because there are a lot of people out there that could say, hey, listen, I've never had a root canal. I'm pretty, healthy as far as that, but I am weary. The foods we eat are more toxic. There's more sugar in everything and more kind of artificial things and everything. More toxins in general are entering the body, and that's going to impact that. So what are your top preventive tips for not getting infections in the teeth?
Well, great question. So those patients that might be saying that to themselves right now, maybe sometime in their life might encounter a tooth that's starting to become temperature sensitive, to cold. Okay. So I think that's a really important discussion to have, because teeth are very mechanical, and a tooth is the only body part that cannot swell. It cannot expand. If it could, it would. So when there's an inflammatory response inside of a tooth, it manifests as a temperature sensitive, or pressure sensitivity, or both. So for those of your patients right now that are seemingly perfectly healthy, their teeth work great and their breath doesn't smell and everything looks fine and they chew fine and they don't have food traps and they don't have bleeding gums, for all those people that are that healthy, that's great. Stay on the path and learn everything you can about your mouth. But for those people who have been healthy for many years and now all of a sudden are starting to have things like temperature sensitivity show up with the tooth. Like I said earlier, a tooth is the only body part that cannot swell. And what that means is the inflammatory response inside of a tooth that's now manifesting in temperature sensitivity is different inside of the tooth than everywhere else in the body, because the tooth cannot swell. And why does the body part swell? It swells because the body is calling for more exchange of fluids, whether that's blood or lymph, the immune system, whatever blood brings. Blood brings oxygen, nutrition, minerals, the immune system, and the lymphatic system, even on the micro, which is the matrix, the inner ocean, and the macro, which is the lymphatic system, the lymph nodes, that has to drain. So you've got this exchange of fluid, and that's involved in the swelling process. So in biological medicine, we believe that inflammation is a tool that is the power of inflammation is meant to be harnessed, not to be suppressed. And that's kind of a difficult thing when you got a tooth going off. It was cold sensitive. Now it just downright hurts all the time. It throbs. So the tooth, what's happening is it's setting up it's accepting more blood because it needs more buffers. Maybe the problem with the tooth is a cavity. Maybe it's decay. Maybe the tooth is stress fractured. Maybe a person grinds their teeth. Maybe the tooth is bending. Maybe it's loose, and its blood supply is threatened, or all the above. All of these conditions could be going on. But a tooth is under its own inflammatory response. And with that inflammatory response inside that tooth, it sets up a blood pressure gradient inside the tooth. So now, because the tooth has accepted more blood because it needs more buffer to buffer all the acid attack, if it's decay or trauma or stress fracture, then so now the blood pressure inside the tooth is higher than the rest of the body. And when we think about that, that's very interesting, because it's a lot like a tourniquet at that point, because when the heart beats at a certain and there's the cardiovascular systems at a certain pressure, that blood is not able to get inside that tooth. And that's why I say it's like a tourniquet, because at that point, a tooth is by design cutting off its own blood supply. And for a lot of people, and this is typically when a tooth is very near its own death experience. Because a tooth will only be able to survive such a thing for a matter of days if there's no intervention there. And again, even biological dentists will say, well, you need a root canal, we got a laser, it's going to be fine. But it's still a death experience for your tooth. And my passion is to keep that tooth alive as long as the death hasn't gotten too far inside that tooth. You must have a cone beam. You must know prolozone therapy. This is where ozone gets involved. This is where we use Swiss biological injectables like Procaine and homeopathy, B12, ozone gas, and then do the dentistry, get the decay out of the tooth. If it's stress fractured, bond that tooth together, make it stronger. Even if it's temporary, just get the conditions changed so the blood supply inside the tooth can start to regulate that, get that blood pressure back down so that cold sensitivity goes away, and the tooth can actually heal itself. Okay. So for dentists to become tooth healers, okay, we must get the body. You can't have a leaky gut and continue. You got to know HRV in order to do this, and you've got to address what I call the inner ocean, which is the extracellular matrix. I believe you can never go wrong by treating the matrix. Upregulating the matrix doesn't come with side effects, doesn't come with problems. It comes with the results. Okay. And we get the gut system working better, and therefore the gut biome is now starting to upregulate towards probiotic because the conditions have been changed. So the bugs are starting to take care of themselves in ways that are incredibly powerful. Okay. Rather than try and take a bunch of probiotics and putting it in the wrong conditions, and those bugs are morphing in the wrong ways. Okay. This is a biome situation as well. Now I'm talking about trying to save the life of a tooth here. Okay. But these are all the forces that are at play as a dentist is trying to help a patient heal their own tooth. Because I think that's what patients want. Oh, yeah. They want their mouths healed. Okay. They want the gut system, the gap junctions to be tightened. You want your teeth long, sharp, and beautiful, easy to keep clean. I think that's what people want. So for those of your listeners that are listening now that are very healthy, but maybe have a friend or maybe have a loved one that is going through a dental, it's like, what the hell do I do with this tooth? Or even a teenager that's coming up in life thinking about getting their wisdom teeth out. You better not. I'm a strong proponent of this being done biologically. Okay. And even surgical procedures, very, very important. This is why I'm training dentists right now. And I'm training doctors and health professionals right now so that they can understand the importance of the mouth to the rest of the body and how do we prevent root canals, okay, from happening in the first place. And what's unique about a tooth, because it can't swell, what's unique about that? And what's unique about the approach to that? So that we take that inflammatory response and we steer it instead of suppress it or remove it completely by killing the tooth. Okay.
Right. No, so much of prevention I found, whether it's in dentistry or just in health in general and in your body, is listening to the whispers of the symptoms before they become screams.
Right.
And if you listen to the whispers, the sensitivity, and everything, that is the whisper of, oh, this is cool. I'm feeling it. I need to do something. I need to act. My body is telling me. And then that is prevention. That's true prevention.